So, I just finished my shift. Overall, today wasn't bad. We didn't see huge volumes overall in the department, but today really for me hammered home one of the frustrations that we're seeing as frontline providers, and that's the fact that based on our current resources, we are very much under testing the population. I see a lot of discussions online with regards to the total number of positive cases as being somehow a benchmark for how we're doing or how we're not doing, and people are modifying their behavior accordingly. But the reality is, currently, I'm only able to swab patients who are either ill enough to come into hospital, healthcare workers, or clusters that are being actively investigated under the guideline of the MHO. So what that means is if I see you in my department and you are clinically stable, your lungs are functioning normally, I'm going to be sending you home and directing you to self-quarantine for 14 days. And that scares me because, 10 years of clinical practice have taught me that unfortunately, patients aren't consistent in following direction. Often what's heard, no matter how we say it, is that if we're not testing you, we're not really taking you seriously, and that's not the case. But it means that we're going to be really, lowballing the actual numbers. And I saw several cases today that I have no doubt are positive cases. So it's important that the public knows this. It's also important that the public understands why this is the case. It's not for a lack of wanting to test. It's the reality that it is still more important that we test those patients that we admit. Because if I am putting multiple patients on a single unit, realistically, we can't keep them perfectly isolated from one another. And so if I have one patient who has COVID and they're roomed with someone who's critically ill who doesn't, then that's going to compromise that other patient's health. So we need to be able to obviously identify those more so than those who are well enough to go home. But it still means that we're unfortunately not performing to the kind of standards that were met at other countries that have been able to effectively flatten their curve, so to speak. So we can't use those countries like Singapore or Korea as a benchmark for what we can expect to come. If anything, I think we have to unfortunately look more to the countries that haven't done as well, because we simply aren't at that standard of quarantine, we're not at that standard of social isolation, and we're definitely not at that standard of testing. In the meantime, we just have to try to do our best with the people we see.